Hey guys, welcome back. This is our weekly RepPath podcast. For any of you guys that haven't joined before, I'm Joe Licata, the founder and owner of RepPath. We've been doing a RepPath leadership series, but today we're gonna pivot a little bit and focus this on the entry level individuals that want to break into the medical sales industry. Because today we're going to talk about how to do it. Okay. And as always, guys, if you haven't subscribed to my YouTube channel, please do that today. It's Unfiltered Medical Sales Coaching. So you can get copies of all the content that I'm putting out, especially all these podcasts, because I get, tons of requests every week of, I missed that podcast. How can I get access to it? Please, click on the link below that James is putting up there now. Unfiltered Medical Sales Coaching. You'll be able to get copies of all this. Okay.
Also, it's on every single streaming platform. So wherever you get your podcasts, make sure you check it out. You can listen to it there if that's easier.
Thank you. Thank you, James. Yeah. So guys, just to dive right in today, before you even get into medical sales, you have to have an understanding of what you really want. People call me all the time and they're like, Joe, I want to get into medical sales, and that's great. Again, it's an amazing career. You're dealing with physicians, you're dealing with patients. It's a competitive space. It's a very exciting space. Whenever you're dealing with healthcare and you could get financially rewarded where you're affecting patients' lives at the same time, I mean, that's a great place to be. It's very rare, and it's also very lucrative. But you have to have an understanding and know, what does medical sales actually mean and what exact space do I want to get into? Okay. So when you talk about medical sales, there's a couple different avenues. Do you want to go into pharmaceutical sales? Do you want to go into device, diagnostics, capital equipment, distribution? All of these have a different, they're all, completely different lifestyle. For instance, the two main areas that people want to get into are either pharma or device. So we're not going to spend too much time about the background of each of these. Just want to give a little quick overview. So some of you guys that are just diving right in, you have a little bit more knowledge. You got to do a lot more research. Obviously, reach out to me, schedule one-on-ones. We can dive, much deeper, to see what the best fit is for you and your background. But the two main ones are device or pharmaceuticals. A couple of quick, pros and cons about both. Number one, if you're looking for a more free lifestyle where you're not going to miss your kids' games, you're going to be more on a schedule. It's more of that 9 to 5. Some would even suggest it's less than 9 to 5. Then pharmaceutical sales is definitely less hours per week. Typically, now I know people listening to this call are going to be like, "Hey, man, I work really hard. I put in 60, 70-hour weeks." Good for you. You might do that. Overall, I'm just telling you what I've learned in almost 25 years in the industry. Pharmaceutical reps have more of that 9 to 5 schedule. So you're going to be able to make those dinners with friends. You're going to be able to make the birthday parties with family, whatever scheduling you're pretty know where you're going to be because you're calling on physicians in their offices. So you're not going to be stuck in cases like in device. Device is much more unpredictable. I've had cases sometimes go to 2, 3 in the morning. Sometimes I had dinner plans I canceled, weekend plans that canceled. Sometimes a case gets booked. It could happen on a holiday. It can happen on your birthday. It could happen on a vacation. If you don't have coverage, which you should have coverage, you got to make sure you're there. So the lifestyle is much different between the two of those. So you have to know what you're getting yourself into. Both are great careers, but it's night and day in terms of the hours in an actual medical facility is much more on average in device. In terms of day to day, most device reps typically, are in cases a lot. So you have to understand too, am I really selling all day long? Because a lot of individuals trying to get into the industry, they think you just walk into offices and hospitals and just do presentations all day. That's not realistic, guys. You're probably only selling 5 to 10% of the time. And people think that's crazy. Like, wow, what am I doing the rest of the day? The rest of your day can consist of covering cases, you know, chasing down, physicians to try to get in front of them, you know, sometimes working with patients because that, depending on the device, that takes a big part of your day, so your actual face time with doctors is a lot less. Now, for a pharmaceutical rep, the majority of their days is not in cases, but they're typically in their car driving from office to office. You know, they're going into doctor's office. Some of them they have good relationships with. They're getting a couple minutes with. Sometimes they're just dropping off material, dropping off samples, going to the next doctor, setting up the next appointment, the next breakfast or lunch. For any of you not in the industry, you have to understand the access is insane how difficult the access has gotten each year since I've started. So when I first started in the industry, you were able to walk into hospitals, walk into doctors' offices. You wait outside their exam rooms. When they pop out after they see a patient, you stop them in the hallway. Hey, doc, I got a new product. Or, hey, what do you think of this patient type? How would you treat it? And then try to get, a couple minutes with them. Now the access has drastically changed. A lot of these offices now are owned by larger hospital groups or hospital systems. So there's much more red tape in place. Going into hospitals themselves is night and day from walking in there with scrubs on and seeing doctors. Now you have to be what's called vendor credentialed. So if you're not credentialed, you cannot get into the hospitals. And even after you're credentialed, so you'll get on, some of the popular vendor credentialing. You guys can look this up. And again, we can have deeper conversations. Is VendorMate, IntelliCentrics, RepTrack, which I think we brought out. So drawing a blank on some of the others. But you have to even be credentialed on those systems first before you actually get into the hospital. And then there's days that the doctors or the nursing staff or the secretary, whoever the receptionist is, has to have you down in the system that you have an appointment that day. So you could be credentialed. They don't have you on the books that day. You're not getting in the hospital. Now, again, some of you might sneak in here or there. At the end of the day, the access is drastically different. So guys that don't have a good understanding of that, it's not about getting rejection. If people say I could take rejection, that's not a good answer if you want to get into this industry. You have to be creative to get past the access issues. The access issues are the number one, roadblock that's in your way. If a doctor tells you no, that's a good thing. That means he spoke to you. So I'm happy when a doctor, tells me no. That means I have access to him. But what do you do when the doctor doesn't even see you? And that's what takes the creativity. That takes the reps that go to the next level. You can't just keep knocking on doors and thinking things are going to change. That doctor can ignore you forever. So it takes a lot of grit, guys, to get that closed door or those just getting ghosted office after office after office. It starts to wear on you because then there's some reps that actually are going, you see Dr. Jones's office, that your company wants you to call on him at least, 2 times a month. And you're like, this is such a waste of time. He's never going to see me. So you start to get, deflated and frustrated. So you got to be creative and come up with other avenues, to get to those doctors. And there's always a way. So the ones that are willing to be persistent and put in the work, then that's something that you can overcome. So again, just want to give a quick overview, guys. We're not going to get into everything else with capital equipment and diagnostics and distribution today, but just know that medical sales means many different avenues. Med tech, medical sales, whatever you want to call it, it's not the same for every avenue. So know what you're getting into first, because it's a drastically different lifestyle and day to day if you don't know what that is. So why do people want to get into this career? You might say, oh, this is for me. I love this. I'm really good talking to people. I could sell. I love to work with doctors. I love to work with patients. Being in the medical field is really cool. I love to be on my own, have my own car, and make good money and be a part of saving lives. Yes, so does everyone else. So again, to have an understanding of how competitive this is, I get 300 to 500 resumes for every job posting, and I get them quickly. So I just posted a management job out in Florida today. I've already got over 250 resumes in less than a day, and by Friday, that'll be well over 500. So now, granted, there's a lot of reps out there, a lot of candidates that aren't really qualified. They're taking a chance just to get their resume in front of me, but there's a lot of great candidates in there. So you have to understand it's very competitive. If you want to do this, you have to really be committed to put the work in to break in, and then once you break in, now it's a whole nother level of competing and trying to be the best rep, quarter after quarter. So everyone wants this great career to get into, but you got to have that commitment, guys, and work ethic to always want to be the best, because it doesn't stop. You can win 5 President's Clubs in a row. You don't hit your number a couple quarters in a row, your company's going to get on you. You heard that saying all the time. I'm sure you guys have heard it. You're only as good as your last sale. It's very true, especially in medical. So you have to be committed to the work, committed to continually getting better in this industry. So let's talk about, what that means about getting into the industry. So some of you guys that, some of you younger guys that haven't graduated from college yet, and you want to do this, to make that mental commitment now while you're still in school is the best time to do that. And I know, guys, I've been there. I was supposed to be a doctor, when I was in college, and, I obviously pivoted to sales. So I never thought I wanted to go into medical sales when I was back in high school and my first couple of years of college. I figured that out, towards my later years and when I got out of college. But for some of you that know, like, this is for me, now's the time. The best thing you can do right now, if you're a freshman, junior, a sophomore, junior, get sales experience. Whatever B2B sales jobs are out there where you're in front of customers face to face. Now, you could take inside sales jobs, making phone calls, trying to sell whatever product or service. There's nothing wrong with that. But if you want the experience that they want to really see, it's getting face-to-face B2B sales experience. The reason why, this is what you're going to do in your medical sales career. You're going to be face-to-face with clinicians. So the one that mirrors that the most, those are the best jobs. And you want from day one to track your sales success. The fact that you worked this summer, when I was younger, guys used to work at Cutco selling knives, which again, in college, that was a great sales job. It gave you tremendous sales experience, but at the end of the day, if you didn't have your sales success on your resume and to keep that documentation, it could hurt you, because at the end of the day, just taking sales jobs doesn't just getting experience is good, but to also get experience and show that you're a top performer, that's how you get job offers in medical sales. So they want to know that you know how to sell, but if you're one of the best salesmen and you have shown results, then that's even better. So from day one, when you get these sales roles, make sure you're tracking 4 different areas that they want to see. You might not have all 4 depending on the size of the company, but you at least should have one of these. And the 4 things are rankings, percent to quota, sales growth, and awards. President's Clubs, Diamond Club, Rep of the Year, Rep of the Month. All those things are very important to have on your resume because that's what they're looking for. They're going to say, that's great. You spent two summers, selling windows, or you spent a couple summers, selling insurance or whatever it is. That's great. How did you do? That's what they're going to ask. What were your results? Now, if you have that down on your resume and you have the documentation in your brag book, and for some of you that don't know, a brag book is a list of all the documentation, printouts of everything, the hard copies of your rankings, of all your successes that you could have on paper. Anything that's in your resume that's a result, you want to make sure you can back it up with your brag book. A lot of reps don't keep these anymore because a lot of managers don't ask for it. But trust me, the ones that have them in an interview, they're the ones that are going to get the jobs because they have the proven documentation. Remember, guys, everything along the interview process is showing them how you would interact in a sales call. So they're constantly looking at whatever you're doing, this is how you're going to sell. So if I'm selling to a clinician and I could come in there with clinical data and proof that I'm not just saying, hey, my product's the best. Look, Dr. Jones, look at this study out of Harvard, that tested 5,000 patients, and showing the doctors that were part of this study. All these things are validation that my product is the best and it's shown to be the best. So when you're doing that, you're doing the same thing with your results. You're selling yourself. You're not just saying Joe Licata is the best. No, look, I have the proof right here. So getting that documentation now is the best time. So any of you in any sales roles, it could be for a mom and pop company. I don't care what it's in, because I hear this from you guys all the time. Joe, oh, my company didn't track that. That's BS, guys. I don't care if they did. You should track it. If you're in a sales role, you should keep track of every sale that you made. You should be asking your manager, your boss, if there's 2 reps in the company, what am I ranked? How am I doing up against Bob or Susan? You want to know that and put that down in because you should only be concentrating on being the best. You do want to compete. They're all about competition in this business, guys. If you don't want to compete, do not get in medical sales. So if you have that and you put that in there, do it now. Don't make the excuse, my company doesn't do that. You should be tracking it yourself. If you sold $10,000 worth of product this month and you sold 20, you could put down that you doubled your growth month to month. So have all that, documented, start it now, and it's going to help you, in your future breaking in. The other thing is when you're trying to break in, some of the things you can do now, start networking now, and I'm not just saying get on the phone and just start calling reps. It's not a bad idea to reach out to reps and, learn more if you don't know much about this industry. Because to really learn, we used to be able to do ride-alongs where you could find a rep and say, hey, can I take you out for lunch or buy you a coffee or whatever? And then they take you out for the day and you could shadow them. It's much, much harder now, guys, where a lot of restrictions within the hospitals, within the offices and companies where they don't allow that as much. You might find someone here or there, and that's great. But you want to learn from these reps, but at the same time, focus on the reps and companies where there's an opening and where you want to work. Because building those relationships now, letting them know that you want this, and you're going to stay on top of them. You're going to keep after this until you break in. That's what they want. They want individuals that are showing that they're committed, and that they're in it for the long haul. So building relationships now is key, because when you get in the interview process, that's one of the keys when you're sending out your resume. You don't just get the resume and then shoot it out and then cross your fingers and say, oh, hopefully somebody responds. That worked 15, 20 years ago. It doesn't work anymore, guys. So it's about building relationships, and the relationships are what help you get a job. I mean, let's be real. If your father or your aunt or uncle is the VP or the CEO of the company and you want to get in versus someone else and you have similar backgrounds, who do we think is getting the job? So it's the same thing, guys. A lot of people still get jobs because a friend recommended them. Because most individuals and most, sales-minded individuals, as long as they can get in front of someone, they do a pretty good job of selling themselves. So, I hear that all the time. Joe, I just got to get in front of someone. If I get in front of them, I'm really good, presenting myself. Yeah, so is everyone else. So do whatever you can to continue to sell yourself and have conversations, show your personality. When they look at a resume, they don't see your personality. They don't see any of that. They don't know what kind of energy you bring. Come in with that with that energy onto the phone calls, and then you'll start, seeing the responses, the positive responses you'll get from these individuals, And also when you're networking, there's sometimes like anything else, you meet someone, you find out different connections that you have, and then all of a sudden now you got a friendship, where they're trying to help push for you. Because you never know who you're talking to. It could be a sales rep that has a lot of say, and is close to that hiring manager. So always put on your best, send your best representative of yourself every time you're having a conversation, because you never know who can help you break in. So number one, getting that sales experience. Number two, building those networking, building those relationships. And next is, no matter what job you're in now, you have to focus on what the transferable skills are. I mean, you literally can go into ChatGPT, and if you're a waiter, say, what are the transferable skills between a waiter and a medical sales rep? And they'll list them, presentation, sales skills, upselling, closing, whatever it is. But start thinking that way no matter what job you're in. If you're a teacher, they present all the time. Teachers are usually excellent presenters as medical sales reps. Anyone clinically, if you're a nurse, a tech, any clinical role, obviously they do really well. They a lot of them are, start out as clinical specialists, but once you know how to sell and clinically you're very strong, you're going to be very good at selling, whatever the product is. So a lot of times anyone with clinical backgrounds do very well in this industry. So you want to make sure you're showing those transferable skills, because the big question that gets asked all the time, well, what if I don't have experience? Can I get into the industry? And the answer is yes, because every single person that has ever worked in the history of any job at one point didn't have experience. So there's always a way to break in. Don't listen to people if they say, if you don't have experience, you can't get in. That's not true. Is it harder if you're going against a rep with 5 years of device experience with sales success? Yeah, of course. But that doesn't mean you can't break into the industry. Even if you don't have a 4-year degree, you could still break in. Now, when it comes to a 4-year degree, just a couple side notes that you have to be aware of. If you want to break in, you can definitely break in. But if you want to get in if you don't have a 4-year degree, it depends on which field you want to get into. So if you want to get into, say, pharmaceutical sales, I would not start, applying to all pharma jobs if you don't have a degree. Because primarily, and again, anyone on this call is like, Joe, I don't know what you're talking about. My friend got in, or my cousin got in with XYZ pharma company, and they didn't have a college degree. I'm sure there's outliers out there, guys. But for the most part, they do not accept reps without 4-year degrees. They typically want a 4-year degree and a year or two of B2B sales before they give you an entry-level role. Now, I know I disagree with this. A lot of entry-level roles that they call it really aren't entry-level. They actually want some sort of B2B. What they mean is entry-level for the pharmaceutical industry. So don't start in pharma if you don't have a 4-year degree. The area that I would start is distribution. Distribution, for instance, to name a company, Arthrex, great company, but Arthrex makes the products, and then there's distributors that, for instance, I can open Joe Licata distribution and sell Arthrex products. So it's usually a smaller, distributor that's out there, that they don't have the big HR department. They don't have all the red tape. So they're willing to speak to reps they're willing to hire reps that they have a connection with, and they don't have to have the 4-year degree. They don't have to have sales experience. They could just say, hey, I really like this guy, and I know he could sell, or I know she could sell, let's hire her. So start with distribution. Start looking at those companies. Again, reach out to me if there's any companies out there that you want to discuss, or any open opportunities. We can definitely work on those together. And before I forget, because I forgot to mention at the beginning of the call, guys, any questions, please submit them. James will field those, and we'll take a break in a couple minutes to handle some of those questions. So I'm sorry I forgot to mention that at the beginning of the call. Please submit any questions, any thoughts, concerns, anything we'll address during this call. Back to, so no degree. So then I would start looking at med device roles if you don't have a degree or experience. Now, I just got a young girl, very sharp individual that graduated from Penn State about 2 months in May. It was only in May. She got a job offer back in April to start, so she didn't even have a college degree yet. Now, granted, she was graduating soon, but she had no, post-college experience, and they hired her. And it's because she showed them that she can do the job by getting the job. And that is so important, guys. So for you individuals out there, no experience, no degree, I can't get in. It's going to be impossible. You're wrong. Show them you can do the job by getting the job. That is so important. So anyone can break in if you show them that. If you're persistent, if you're networking, if you're showing your transferable skills, this is exactly what you would need to do if you're in that role. Doctors aren't going to just say yes to you the first day you walk in. You're going to have to call on them dozens and dozens of times. Sometimes it takes over a year to penetrate some physicians. One of the hospital systems I called on for over 3 years to get a deal across. So it's time consuming, guys, but you got to be persistent. Same with this industry. When you're showing them, and I'm not saying you're going to spend 3 years to try to break in. I mean, obviously we're doing something wrong if it takes that long, but show them that you can be persistent. Show them that you can do the job by trying to get the job, by showing your transferable skills, whatever it is that shows them and makes them confident that you are a good sales rep, start doing that now, because it'll help you in the future when those openings come up. But while, we're almost at 3:30, James, if we have any questions from the crowd as I take a drink here, please let me know. James?
I was muted. I apologize. Almost famous kid. Thank you for sharing. Almost famous kid on Instagram said, "Thank you for sharing your experiences and insights in the sales field." We have, let's see. What do people get wrong about the day-to-day lifestyle between pharma and med tech?
Well, I mean, I think they made med device, and it's thinking that you're going to be in front of doctors. What I think is, like I was talking about before, one of the biggest misperceptions is you're not going to be in front of doctors selling all day long. When you're for pharma, let's start with pharma. You're in the car traveling from office to office. A typical pharma sales call is you walking into the office. You'll have either samples, you'll have promotional material, you'll speak to the receptionist. She might tell you, Joe, this is not a good day. Can you come back another time? Or Joe, he does, Dr. Jones doesn't see reps. So what a lot of reps do, and this is the real side of the business, they go, okay, I'll come back another day. Or, here's some pens or whatever promotional material that they're even still allowed to give, because a lot of stuff you're not allowed to give. But they'll try to book a breakfast or a lunch or try to get on the calendar, and they come back another day, so that could take 30 seconds, could take 5 minutes. If you're waiting, a lot of times you're waiting to go up to the front to speak to the receptionist. They might tell you, yeah, Joe, you know what? Doctor could see you, but there's 2 reps in front of you. Okay. So now you're waiting for patients to be seen. They send a rep back every couple of patients. You can wait there. I've waited there sometimes 2 hours, just to see a doctor, maybe for a minute. And that's real. So it's not, hey, doctor, and you come in with your easel and you're presenting and you got your products and you're talking to him or her for 45 minutes. It doesn't work that way, guys. It's usually something quick. You go sit there in the back, or you see them in the hallway and they're like, Joe, what do you got for me today? And they're literally waiting outside the exam room to go in to see their next patient. And they go, oh, okay, great. That sounds good. And then they walk in to see a patient. So that's a real call that, your job is to keep them engaged, is to do something, each time that isn't repetitive. A lot of reps, they get lazy. They call on a doctor 10 times and then they get in there like, hey, Dr. Jones. And he's like, yeah, Joe, I know, you got XYZ drug. Trust me, I'm trying to find you patients. Okay, good. And then they walk out. I mean, that happens a lot. So you have to bring value, because these doctors, if you're constantly not bringing value, they're going to give you less and less time. So long-winded answer to, you have to understand that, but it's in pharma, but it's also in device too. You're not selling majority of the time. You're traveling, you're trying to book appointments. On device, you're covering cases. You might be meeting with patients, but your FaceTime with physicians is probably only 5 to 10% of the time.
Okay, we have how do I position myself if I don't have President's Club or any rankings yet?
Well, start looking at your quota. You should have a quota. And if not, if you're starting a sales job today, guys, that's another good thing to bring up. Ask your manager, what's your quota? If you work for a mom and pop, what's our quota? They should know something. They might just say, just go out there and sell. I don't care what you do, but ask them, give me a quota. What is a number I'm supposed to hit this month? Give yourself something that you have to achieve. Going out there with your head down and just trying to sell is, there's nothing wrong with that, but you should have something in mind that, like, all right, I'm going to close 10 deals this month. Because then you could start, figuring out the work that you need to do that. So, I know a lot of guys in the military, they've taught me, my military friends, that whatever the problem is, they work backwards. So do that same thing. If you once you know your goal, that you have to sell $10,000 worth of whatever product this month. Okay. So how many sales is that? Oh, that's 10 sales. Okay, great. So if I need 10 sales, how many doctors would I need to call on, or how many customers would I need to call on? Well, if you're going to get 10 sales, obviously it's going to be, it could be 10, that's 10 customers. All right. So if I'm going to close 10 customers, how many do I have to call on? Well, you're probably only going to close 10% of the time. So I got to call on 100 customers to get that. So to call on 100 customers, that means I have to reach out, to 500 to get in front of 100. So that's how you work backwards. So start doing that now and figure out what your quota is, because then you could figure out what the workflow is to get there. And then you could also keep track of that. You also, without rankings, can keep track of growth. So if you sold 1 this month, you sold 2 the next, you grew by 100%. So it's that simple. So always keep track of those 2 things. It doesn't matter what sales role, what company, you always can keep track of your growth, and then ask them, if you don't have it, what your quota is, and try to hit that goal, because they're going to ask you. If you don't have quota, if you don't have if you don't have any of the results I talked about, rankings, quota, growth, and awards, they're going to question, was that really a sales job you were in? Because if you don't have any of that, they either think you weren't in a real sales job, or you didn't do well and you don't want to talk about it. You don't want to put that down. So start asking those questions now and putting it down, because it's only going to help you in the future.
So this question looks like it's coming from someone who is a rep. How do you balance learning the clinical side and still being an elite closer?
So it's, how do you balance learning the clinical side and still be an elite closer? I mean, you really, it doesn't, one shouldn't affect the other. I mean, if you're uh, most high performing reps, if they have clinical responsibilities, they have to be good at both. So so let's talk about the clinical side. Most individuals think to be good clinically, you have to be the one that's totally owning the room and talking the whole time, and like almost like a conductor. Okay, nurse, you do this. Dr. Jones, okay, take that, put this here, do that. It's not the way it works, guys. The best reps shut up and they don't jump in until they're needed. They're there, they're in control. If they see something that is not correct, and you'll see this, when, in many cases that I was in, I saw a physician doing something that was incorrect. I just nicely tell them, hey, doctor, what about if we try this? And they get it. They know that, oh, shoot, he was right. I forgot that you have to, put this one piece on, or, I have to go laterally, or, anterior instead of posterior, whatever it is. They, sometimes it's not a big deal, but they know that you're there, and you know when to jump in and when not to. So being clinically sound is great, but more importantly is knowing when to talk and when to shut up. And the majority of the time you should shut up and just be quiet. You don't want to jump in and be the chatterbox in the room and just constantly, feeling like you have to say something to say things. That's not what a good rep does. It's not what a confident rep does. So you will get more respect by jumping in when they need you and not, trying to take over the case. That you won't get invited back if you're doing that all the time. Because at the end of the day, the physician is responsible for that patient. No matter what goes wrong, your device, something else could go drastically wrong. It's still on the doctor. You're there to be an asset, but you're there to assist the doctor and his staff. So that you have to, do well. That's one aspect on the clinical side. And being a good closer, closing obviously is very important, but it's not about every call closing. You're closing on interviews. That's great. They want to see that you're closing, but it's always moving the process, further along. If a doctor uses you for one procedure and there's 10 other procedures that he can use your device on, it's starting with that low hanging fruit and getting that physician comfortable using your device on that patient. Or if it's a medication, trying it out on the real bread and butter patients. And then once they get get comfortable using that drug, now we start moving them along the line to the patients that, also can, find a need for this, but they might not be thinking of firsthand. So it's that progression. The good reps, the top high performers are constantly progressing the sale. It's not like they're just closing, hey, doc, do I have commitment every time you're with them? No, it's building trust. They got to know that, Joe Licata, every time he comes in, I have nothing to worry about. If I have a question, if there's a problem, Joe's going to be there. He's going to help me. That's the biggest compliment they can give you guys, is that they trust you, because then you'll earn the respect of that physician, and then they'll want to use you more and work with you more. So those two things are separate. I hope I answered that, but don't look at them like you got to do one at the same time. They're two separate things. But if you do both, and follow some of the tips I just gave, you'll be in good shape.
Yeah, I think he meant like learning the clinical side more so than actually being in the clinical side. Is it still worth applying if you don't have business to business, B2B experience or clinical background?
100%. That's the quick answer. The answer is yes. But what I would, the question I would ask you is, how bad do you want this? If you're a lot of reps, a lot of candidates, they want the instant gratification. They'll say, if I can't get, if I want to do this, but I don't want to go back to school, or I don't want to spend a year doing a B2B job. That's just too much time, too much work. Guys, you could be in this industry for 50 years or more. So if you're not willing to put in some extra time, trust me, your competition is. I question, is this the right, field for you? So if you don't have that experience, you don't have the B2B, try to get it. But if not, as you're applying, show them, do the things that I talked about. We're showing them you could do the job by getting the job. Show how you can, you have those transferable skills to be a great sales rep by whatever you've done in the past. You could have been a waiter. Again, waiters could be great sales reps. They're constantly interacting with customers. The great reps are upselling. They're selling. Instead of just taking an order, they're trying to get the patron to get a beer or to order a dessert, whatever it is, to bring that check up, because then they're going to make more money with their tip. So do whatever it is and illustrate those transferable skills, and you will be able to break in. So but my question back is, how committed are you? And do you want to really put in the work and the time? Because your competition is going to do it. So if you're not willing to do that, then don't move forward.
So that kind of goes into the next question, actually. How can I showcase those transferable skills from places like retail or even athletic backgrounds?
Yeah. So first off, with an athletic background, a lot of companies, you'll hear companies, they love, scholar athletes. They, if you're a Division I football or baseball player, a lot of college athletes, they love college athletes, a lot of companies. Reason being, you know how to compete. So competition is key. They want you, if you know how to compete at a high level in sports, then you're going to be able to compete at a high level, at least, theoretically, in medical sales. You want to be the best. You know about putting in hard work. You know about discipline, commitment, all those are transferable skills that you're going to need to get into medical sales. So it's obviously same goes with the military. It's hard work, it's commitment, it's discipline. All these things make you a better rep. And so just illustrating that, and giving examples. So that's another key thing, guys. No matter what you do, whether it's talking about a transferable skill or about whatever reason it is why you're a good fit, don't just give an adjective without a follow-up example. Especially when you're in the interview process, one of the worst things reps can do is, I'm a hard worker. If you're a hard worker and you didn't show me during this interview process how hard you work to get this job, that means nothing to me. It actually can hurt you, because I'm like, well, you're just all talk. You had a chance of a couple of weeks during the interview process to really show me how hard you could work, and outshine the other candidates, and you didn't. So those just become words. But if you say, no one's going to outwork me, as you can see during the interview process, I created this business plan based on the research that I did by speaking to 5 different reps. I reached out to 60 reps at this company, spoke to these 5 reps. You list them. I worked with a medical sales coach, and I'm not just saying that to throw in my, my cheap little promotion for RepPath, but it's true. Show them whatever you did. I have an aunt or uncle that's in the industry. She's my mentor. I spoke to her about this. I researched things on YouTube. I've researched things online. I read these studies. I spoke to these physicians. All that you got to show, and then now when you say no one outworks me, the manager is going to go, yeah, I kind of agree. I mean, you did everything and you outworked everyone, to get this role. So I believe that. So always talk about the actual examples, no matter what you say or what you do.
All right, that's all we got for right now.
Okay.
I'm sure there'll be a couple more towards the end of the show.
Sure. Perfect. Thank you.
Yeah.
So next we're going to talk about, resume and LinkedIn. Again, we're not going to do a whole resume optimization call here because we don't have time, but just a few minutes with the resume, guys. Couple of quick tips. First and foremost, do not have your resume saved as a Word document. Okay. Always convert to PDF. When I get it, when hiring managers get these resumes, when recruiters get their resumes, most hiring managers and recruiters, they're not sitting at their desk all day long at their laptop. They have their cell phone, they get a resume, they click down, they look at it. When it's saved in a Word document, most of you guys might know this, but for some of these that don't, the formatting is off. So, but if it's saved as a PDF, it's always going to be spot on. So always convert to PDF, because even though as a recruiter and, former leader, sales leader, I know that that's you're not, the formatting isn't really off. I know it's because you saved it in Word, but when your competition saves it in a PDF, it's hard for me not to look at those other reps and going, well, they had, more attention to detail here. They're more polished and more, on point to make sure that they're presenting everything, correctly. So that's number one, save it in PDF. Number two, put just when you're listing at the top of the page with your name, your email, your cell phone, your phone, and you could put in your LinkedIn profile. We'll talk about LinkedIn too, but put the city and state down. You do not need the street address. If you put it down, that's fine, but we don't need to know that you live at, 2020 Main Street in Milwaukee, Wisconsin. They just put down Milwaukee, Wisconsin. And so a lot of you keep that blank, and I know that the rationale is if I leave it blank, then I'm open to any opportunity around the country. It's actually the opposite, guys. So just to give you a quick background on what happens with a resume. When I get resumes, I enter it into what's called an ATS. And an ATS is an applicant tracking system. So most recruiters, most companies, their HR departments, they have some way of tracking all the resumes. I mean, they don't just remember thousands of reps that applied and say, "Oh, you know what, Susan would be a good choice for Miami, Florida. Let's give her a call." I remember speaking to her, 2 years ago. No, obviously everything gets saved into these databases. So we get the resume, I save it in there. When it saves it, it parses the resume. And by parsing it means now we have searchable words that I look up, a bunch of resumes are going to pop up. So when I have an opening 6 months down the line in Boston, Massachusetts, first thing I'm going to do when a company says, "Hey, Joe, I need a candidate with 4 years of pain experience in the Boston area," first thing I do is type in Boston, Massachusetts, search word pain. Okay. Now, if you don't put your city and state in there, you're not going to show up. So I'm going to forget about you, and then you're not going to show up when I do a search. So always put the city and state down there. It's only going to help you. The other thing is the difference between when you're actually writing the resume, when you get into the summary. Now, I'm not a huge fan of summaries, only if they're very specific. So if you look at your summaries today, and I challenge you guys all to do this, look at your summary and you'll get a feel just by looking at it. Does this really say who I am? Or is this describing, millions of reps that are out there? Career driven, sales management experience, results oriented. And you're using a lot of adjectives that really don't mean anything. And you could use that to describe anyone. Then those aren't the types of summaries that I like to see. I want to see the exact number of years you have in the industry. If you've been in the industry for 12 years, put 12 years of experience. Give me the experience. Have you been in the hospital space? Have you experienced with buy and bill, specialty pharmacy, value analysis, the VAT committee? Do they have that experience with IDNs, whatever hospital systems, real experience that not just anyone can put down. That's huge. So if you do that, then you can formulate a good summary that really has your skills, not just adjectives, in the description. So summaries are good when they're specific. And when you get to the bulk of your resume, and this is the last part, we'll talk about resumes, but make sure that it's focused on your results. The 4 areas we talked about: rankings, percent of quota, sales growth, and awards. Those 4 guys, that's exactly, that's what the bulk of it should be. The more numbers that are on your resume, the better. So for any of you guys that are sports fans out there, if you're a baseball, football, soccer, whatever it is, most of you have seen the back of a sports card. It's loaded with stats. Again, always use Michael Jordan because everyone knows Michael Jordan. Michael Jordan doesn't have descriptors about how Michael Jordan, shot 30,000 shots a day and did 500 push-ups. And sometimes he passes the ball to Scottie Pippen. Sometimes he dunks the ball. Sometimes he dribbles down the lane and pulls up and shoots a jumper. Those are all daily activities. They don't need to see that. They want to see 6-time NBA champ, 5-time MVP, 10-time scoring champ, 20-time All-Star. Those are his results. So that's what I want to see. That's what hiring managers want to see. They've never in the history of medical sales had a manager ever said to me, "Joe, that rep was so good, but I got to be honest, she just had too many results on her resume." I mean, it's just not going to happen, guys. So the more numbers, the more results, and the less about daily activities is a better resume. It's more appealing to a hiring manager and a recruiter. And those are the reps that are going to get more interviews booked. So when you're talking about your daily activities, that's you save for the interview. The resume is supposed to pop out with your results. So then the hiring manager goes, who is this guy? I have to meet him. You know, who is this Beth person? I got to meet her. And then when you get in front of them, that's when you say, here's my strategy. Here's how I did this. Here's my daily activities. This is what I did every day. Here's my process. That's what they want to hear in the interview. But you don't want to have that all, blended in and just very verbose on a resume. It bores people. They don't really read it. But when they see results, their eyes get attracted to that. So make sure that that's your focus with your resume. And when it comes to LinkedIn, some of you that if you're going to put your LinkedIn profile as one of your contacts on there, make sure that it's airtight and it exactly matches your resume. So a lot of you, let's be real, guys, you leave jobs out that you were there 3 months, or there was something that happened you don't want to really talk about. So you don't put it in there, and then your resume has it, or vice versa. Your resume doesn't have it and your LinkedIn does. If they don't match, huge red flag. Now, I've had recruiters call me, and there's times that I miss it too. And they're like, Joe, what happened? It shows on the resume that he, went from Stryker to Medtronic. But then when I look at his LinkedIn profile, he had ABC company in between. Now, if it's going to be off, guys, trust me, recruiters, a lot of times that are checking that out, they won't move you forward to the hiring manager if they catch that. Because if that's one thing, it's a red flag, they're not going to push it. They'll just say, you know what, I'll move on to another candidate. So make sure that it's airtight and it's in there. Make sure again that your resume, your LinkedIn profile matches your resume pretty similarly. Have your accomplishments in there. List those, under each role. It really should mirror that. The main thing about a LinkedIn profile is they get to see the person. Now they can put a face with the name. So it's good to have that. Some of you that have your pictures on the resumes, I'm not a fan of that. I'm not saying it's absolutely a big red flag. Don't do it. It's dumb. No, I'm just saying that's not for me. Because a lot of times it gets a little too loud, and there's a lot of reps now add graphs and charts and all these colors, and it gets crazy. And at the end of the day, they want your results. So save the picture for your LinkedIn profile. Obviously have a professional headshot, spend a few dollars to get that done because it's a huge difference. You don't want the picture that you had at your cousin's wedding 6 years ago. Pay a few dollars to get it done, guys. It makes such a world of difference. And I'm someone that used to have one of those pictures. Thinking back, looking at that, it definitely cost me opportunities because it's just what you're going up against. Look at a lot of people's pictures. A lot of them are professionally done. So if you're going to have a random photo put up there because you had a good tan or whatever the reason you look good at the time, trust me, they're going to go towards that professional photo, 99% of the time. So before we move on to certifications, James, any other questions, comments, anything from the crowd? You're on mute again?
Yep, I am on mute. I just don't want you to hear the fan going in the background because our AC is off.
It's okay.
Where is it? How should reps approach networking on LinkedIn the right way without being spammy?
So again, start with the opportunity that really exists. So don't just, again, you want to reach out to people here and there, give a number. If you're just blindly reaching out that, I'm going to reach out to 10 people a day, 20 people a day, create the little message that you want to send out, personalize it to whoever you want to send it to. But I think network with a purpose. Don't just network to network, because you can spend the next 40 years of your life contacting people on LinkedIn and having conversations and get nowhere. It's an amazing resource, but there's just too many people. So see what the opening is first. If there's an opening at Medtronic, in their CRM division, then start with reps in whatever area you want to work in that are in the CRM division of Medtronic. Don't just send, connections out to people that just work at Medtronic. You want to be more laser focused start with where the opening is and then network around that opening. That's the best way to approach it, because especially when there is an opening, and obviously the other reps, they're going to know that there's an opening there. And when you say, hey, I'm interested, or I just applied, I would love to jump on a call, just a couple minutes of your time, they're more likely to respond to you than if you're sending out to another Medtronic person that doesn't even work in that division. Medtronic's a huge company. They might have no clue that division even exists, because when I worked at Boston Scientific, there were divisions I didn't even know that were part of Boston Scientific. I would meet reps in the field, didn't even know we worked at the same company. That's how big it was. So if there's an opening in another division, I don't even know about it. And I'm less likely to respond because, quite frankly, it means nothing to me. So definitely start with the opening and then network around that opening.
Okay. Where is it? What's more important, shadowing reps or taking a sales training course?
Both can provide value. Sales training courses, some are very good, but you also, guys, nothing is better than sales experience. So both of those, shadowing reps, yeah, that's great. You can learn a lot in a day. It's still, you're not going to get a job just because you shadowed a rep. There's good training courses that are out there that can help you to get jobs. Don't get me wrong. There's great sales training that help people break in. There's great schools that help people to break in. But if someone has 2 years or a year of B2B sales experience versus someone that has sales training from a course, the person with B2B sales experience, is in the driver's seat to get that job. So it's not so much about all those things you can do. You could do both. So if you're talking about a ride along and a sales training course, you should do both. So don't make it like which one should I pick? No, do both. And at the end of the day, try and get sales experience. Get it all, because your competition is doing it. So I keep saying that, guys, but it's easier for me because I see the competition, because they're coming to me for jobs. They're coming to me to break in the industry. I see the spectrum of the experience and expertise that people have. So there's tons that have that. So do it all, because that's going to help you become the best candidate to stand out.
We have is it okay to DM or message hiring managers if they're not responding to my application?
Absolutely. You didn't get the job anyway yet. So don't be afraid. I'm not saying sit here and be, guys, one thing when it comes to reaching out and being persistent, you got to have common sense. You don't want to be a pain in the ass. If you're going to be annoying and that's something that you really can't teach. There isn't something that's a rule like every, 36 to 48 hours, you could send a message. Like there's no written rule for that. Just have common sense, guys. If you really want the job, and especially if the hiring manager spoke to you, interviewed you, you have the right. I think anyone that gets interviewed, that company should get back to them. And we've had this on previous podcasts where, sometimes this is where companies, some do a great job, some don't. And even with recruiters, you're waiting for companies to get back to you, and it's a couple of weeks before they tell you, yeah, no, we're going to pass on that candidate. I don't think that's right. I think once they know that they're not moving forward, they should let the recruiter know, and there should be a direct, message to that candidate at a respect of their time. So getting back to the follow-up, definitely follow up, be persistent, but just common sense. Don't be a pain in the neck. And then also don't get frustrated because someone isn't getting back to you and get deflated that like, oh, this sucks, I'm never going to break in. You guys, just move on. You should have plenty of other opportunities that you should focus on. Don't just focus on the one opportunity, because you will get let down many times. You just got to keep going.
I think this is from the same guy asking about messaging reps, what's the best way? Hold on, where is it? What's the best way to send a message to a rep or manager on LinkedIn?
Best way to send a message to a manager on LinkedIn, is the shorter the better. You want a simple rule. If I have to scroll on my phone to read a message, it's too long. So a lot of you guys do this where, when you send a resume, for instance, when it comes to sending this, don't say, I get this a lot. And some of you guys might not do this. Some of you do, Joe, I'm interested. There's nothing that frustrates me more. I have no idea what the hell you're talking about. You didn't even tell me the job you're applying for. Sometimes I'm working with 30, 40 openings at once. I have no clue what you mean. And the more that I have to try to figure something out when I'm, doing a million other things, most recruiters aren't going to do that. So you want to just quickly, in a couple sentences, just ask what you want to ask. If it's about an opportunity, hey, Bob, I'm interested in the Southwest district manager role, or the Southwest entry level role for, ABC company, very excited for the opportunity. Would love to, here's my resume, and would love to discuss, whenever you get a chance. How's Monday or Tuesday? It's just something real brief, and I'm making that up off the top of my head, but the shorter, the better. Get to the point, send your resume. Don't write War and Peace and thinking they're going to read all that, but also don't just say, hey, I'm interested, and send a resume. You got to give a little bit of clarity of what you want.
And I think that is it. Yeah, that's all I have right now.
Perfect. I think, for today, we're a little over time, which is fine. Just anything moving forward, guys, and we'll continue these. Again, we do podcasts every Wednesday at 3 p.m. Eastern. So some of the things that we didn't get to this call, we'll definitely get to on future calls. But any other questions, any of you out there that are trying to break in or trying to advance in your career, and you're stuck, you hit a roadblock and you don't know where else to turn, definitely reach out to me. You can either shoot me an email, joe@reppath.com, or send me a message, DM me on LinkedIn. And then, like I said at the beginning of the call, guys, please subscribe to my channel, an Unfiltered Medical Sales Coaching, and we can book one-on-ones and get to exactly the needs that you need. And lastly, before we end the call, for any of you on this call, and specifically for any lobby members, the promo code for today is Licata, and that's Licata. So shoot me that if you're looking and you're interested in one-on-one training, to get additional discounts. So that's anyone on the call, including any lobby members. The promo code is Licata. So I thank you guys again for joining. Hope to see everyone next week, and look forward to hearing from you guys soon. Have a great week.